Question 1. A Class 3, Class A, torsion balance has a sensitivity requirement of 6 mg. To ensure an error of 5% or less, what is the minimum weighable quantity, MWQ? A. 60 mg. B. 100 mg. C. 120 mg. D. 240 mg. Answer: C. 120 mg. This question tests the calculation of the minimum weighable quantity, MWQ, a critical safety concept to avoid measurement errors. The keywords are sensitivity requirement of 6 mg and error of 5% or less. The formula to use is MWQ equals sensitivity requirement / maximum acceptable error, as a decimal, which is 6 mg / 0.05, equaling 120 mg. This calculation ensures that any measurement of 120 mg or more on this specific balance will be accurate within the acceptable 5% margin. Always remember this simple formula: divide the balance's sensitivity by the percent error you're allowed to find the smallest amount you can weigh accurately. Question 2. When camphor and menthol powders are mixed together, they transform into a liquid at room temperature without the addition of any solvent. This phenomenon is an example of A. Eutectic mixture. B. Suspension. C. Emulsion. D. Leviation. Answer: A. Eutectic mixture. This question assesses knowledge of specific physicochemical interactions between compounding ingredients. The key clue is that two solids, camphor and menthol, form a liquid when combined. This phenomenon describes a eutectic mixture, where the combined melting point of two or more substances is lower than the individual melting points of each component. This is not a suspension, solids in a liquid, or an emulsion, liquids in a liquid, and leviation is a technique, not a final product type. Thinking of it like this can help. Some solids, when mixed, melt each other, a special property important to anticipate when compounding certain formulas. Question 3. Which of the following documents provides the specific step-by-step instructions, ingredients, and equipment for preparing a compounded product and is created before the first fill? A. Compounding record, CR. B. Prescription order. C. Safety data sheet, SDS. D. Master formulation record, MFR. Answer: D. Master formulation record, MFR. This question tests the understanding of essential compounding documentation required by USP less than 795. The keywords step-by-step instructions and before the first fill point directly to the master formulation record, which is the official recipe for a compound. This document ensures that every time a specific compound is made, it is done so consistently and correctly, regardless of who is preparing it. The compounding record, by contrast, is the log filled out for each specific prescription, documenting that the MFR's recipe was followed. Think of the MFR as the cookbook recipe, and the compounding record as the notes you take each time you cook that specific dish. Question 4. A pharmacist needs to prepare 240 g of a 3% hydrocortisone ointment using a 10% hydrocortisone ointment and petrolatum, which contains 0% hydrocortisone. How many grams of the 10% ointment are needed? A. 72 g. B. 80 g. C. 168 g. D. 216 g. Answer: A. 72 g. This question requires the use of the alligation method, a common pharmacy calculation for mixing two different concentrations to achieve a desired final concentration. The goal is to make a 3% ointment by mixing 10% and 0% products. Using the alligation tic-tac-toe grid, you find the difference between the desired concentration, 3%, and each of the starting concentrations, 10% and 0%, which gives you 3 parts of the 10% ointment and 7 parts of the 0% petrolatum, for a total of 10 parts. To find the amount of 10% ointment needed for the 240 g total, you calculate 3 parts/10 total parts, * 240 g, which equals 72 g. This method is a visual and quick way to solve for the correct proportions needed when mixing stock preparations. Question 5. According to USP Chapter less than 795, what is the maximum beyond use date, BUD, for a non-aqueous formulation, such as a zinc oxide paste made with petrolatum, when prepared using USP-grade ingredients? A. 14 days. B. 30 days. C. 90 days. D. 6 months. Answer: D. 6 months. This question tests knowledge of assigning beyond use dates, BUDs, as specified in USP less than 795. The key phrase is non-aqueous formulation, which means a preparation that contains no water, like an ointment or paste made with a base like petrolatum. Because the lack of water significantly reduces the risk of microbial growth, these formulations are given a much longer default BUD. The standard is 6 months or the earliest expiration date of any active pharmaceutical ingredient, API, used, whichever comes first. Remember to always categorize the compound first, aqueous oral, aqueous topical, or non-aqueous, as this is the first step in determining the correct BUD. Question 6. A technician needs to incorporate a gritty powder into an ointment base to ensure a smooth, non-gritty final product. Which technique involves using a small amount of liquid in which the powder is insoluble to aid in particle size reduction? A. Trituration. B. Spatulation. C. Levigation. D. Geometric dilution. Answer: C. Levigation. The concept tested here is particle size reduction to improve the quality of a semi-solid preparation. The keywords gritty powder, ointment base, and small amount of liquid point to the technique of levigation. Levigation is the process of wetting a powder with a liquid, the levigating agent, like mineral oil or glycerin, to form a paste, which is then incorporated into the ointment base. This process reduces particle size and prevents the final product from feeling gritty on the skin. A good way to remember is that levigation levels the particles to make them smooth. Question 7. According to USP Chapter less than 800, non-sterile compounding of a hazardous drug, HD, must be performed in which type of environment to protect the compounder from exposure? A. A laminar airflow workbench, LAFW. B. A standard compounding counter with good ventilation. C. A containment ventilated enclosure, CVE. D. Any clean room certified for sterile compounding. Answer: C. A containment ventilated enclosure, CVE. This question assesses knowledge of safety standards for handling hazardous drugs, HDs, as outlined in USP less than 800. The key concepts are non-sterile compounding and hazardous drug, which require special containment to protect personnel. A containment ventilated enclosure, CVE, often called a powder hood, is designed with negative pressure to pull powders and particles away from the operator and into a HEPA filter. A laminar airflow workbench provides no personnel protection and would blow hazardous particles toward the compounder, making it unsafe for this task. The rule is simple: if a drug is hazardous, it must be handled in an engineering control designed for containment. Question 8. The process of grinding a coarse, crystalline powder into a fine, uniform powder using a mortar and pestle is known as A. Geometric dilution. B. Trituration. C. Pulverization by intervention. D. Spatulation. Answer: B. Trituration. This question tests the definition of a fundamental compounding technique. The keyword here is grinding a powder into a fine powder, which is the exact definition of trituration. This is a purely mechanical process used to reduce the particle size of solids to ensure they are evenly dispersed in a final preparation. It should not be confused with other techniques like geometric dilution, for mixing unequal amounts, or levigation, which involves a liquid. Think of trituration as simply crushing and grinding a solid to make it smaller. Question 9. When compounding a liquid suspension, which type of excipient is added to increase the viscosity of the liquid and slow down the rate at which drug particles settle? A. A surfactant. B. A levigating agent. C. A suspending agent. D. An emulsifier. Answer: C. A suspending agent. This question tests the function of specific inactive ingredients, excipients, in different dosage forms. The keywords are liquid suspension and slow down, settling, which directly describe the purpose of a suspending agent. In a suspension, where solid particles are dispersed in a liquid but not dissolved, these agents, like methylcellulose or acacia, make the liquid thicker. This increased thickness, or viscosity, helps keep the drug particles evenly distributed for longer, ensuring the patient receives a consistent dose each time. A helpful tip is to remember that a suspending agent suspends the particles in the liquid. Question 10. For which of the following compounding scenarios would a glass mortar and pestle be preferred over a Wedgwood or porcelain mortar and pestle? A. Grinding a hard, crystalline substance into a fine powder. B. Preparing a liquid emulsion that requires vigorous mixing. C. Mixing colored powders or substances that could stain. D. Compounding a large batch of an ointment. Answer: C. Mixing colored powders or substances that could stain. This question assesses the appropriate selection of compounding equipment based on the properties of the ingredients. The key factor is the colored powders or substances that could stain. A glass mortar and pestle has a smooth, non-porous surface, which makes it ideal for this task because it won't absorb the color or get stained. In contrast, Wedgwood or porcelain mortars have rougher, porous surfaces that are excellent for grinding hard crystals but would be easily stained. Always choose glass for liquids, dyes, and chemicals that might react with or stain a porous surface. Question 11. What is the primary purpose of the hydrophile-lipophile balance, HLB, system in non-sterile compounding? A. To determine the beyond-use date of an emulsion. B. To select the most appropriate emulsifying agent. C. To calculate the amount of preservative needed. D. To measure the pH of a topical cream. Answer: B. To select the most appropriate emulsifying agent. This question focuses on a more advanced concept used in creating stable emulsions. The hydrophile-lipophile balance, HLB, system is a scale used to classify surfactants, also known as emulsifiers, based on how much they like water, hydrophilic, versus how much they like oil, lipophilic. To create a stable oil in water, O/W, or water in oil, W/O, emulsion, the formulator must choose a surfactant or blend of surfactants with an HLB value that matches the oil phase of the preparation. Essentially, the HLB system is a tool that helps you pick the perfect matchmaker to get oil and water to mix together happily. Question 12. A prescription requires 30 milliliters of a liquid medication. If the specific gravity of the liquid is 1.4, how many grams of the liquid should be weighed? A. 21.4 g. B. 30 g. C. 31.4 g. D. 42 g. Answer: D. 42 g. This question tests the ability to perform calculations involving specific gravity, a common task when it is more accurate to weigh a liquid than measure its volume. Specific gravity is the ratio of a liquid's density to the density of water, so a specific gravity of 1.4 means the liquid is 1.4 times heavier than water, where 1 milliliter of water weighs 1 g. To find the weight, you multiply the volume by the specific gravity. 30 milliliters asterisk 1.4 is equal to 42 g. Remember this key relationship, weight, g, equals volume, ml, times specific gravity. Question 13. Which compounding technique is essential for ensuring that a very small amount of a potent active ingredient is uniformly distributed throughout a large amount of diluent? A. Spatulation. B. Sifting. C. Geometric dilution. D. Levigation. Answer: C. Geometric dilution. This question tests a critical technique for ensuring dose uniformity and safety in compounded products. The keywords small amount of a potent active ingredient and large amount of diluent are the classic indicators for needing geometric dilution. This method involves mixing the smaller quantity of ingredient with an approximately equal quantity of the larger quantity ingredient, then continuing to add the diluent in amounts roughly equal to the volume of the mixture in the mortar until all ingredients are combined. This stepwise process prevents the small amount of active drug from getting lost in the large bulk of diluent and ensures every dose will be consistent. Question 14. In addition to standard prescription label information like patient name and directions, what statement is federally required on the label of a non-sterile compounded preparation? A. This product was made in a pharmacy. B. For investigational use only. C. This is a compounded preparation. D. Shake well before using. Answer: C. This is a compounded preparation. This question covers the specific labeling requirements for compounded drugs that distinguish them from FDA-approved manufactured products. The key concept is regulatory compliance for patient awareness and safety. Federal law and USP standards mandate that the label clearly state the product has been compounded to inform the patient and healthcare providers that it is a customized medication not evaluated by the FDA for safety or efficacy. While other statements like shake well may be important auxiliary labels, the compounded preparation statement is a fundamental legal requirement. This helps everyone know it's a unique medication made just for that patient. Question 15. A technician is preparing a topical cream that contains water and is intended for application to the skin. According to USP less than 795 guidelines, what is the maximum beyond use date, BUD, for this type of formulation when stored at room temperature? A. 14 days. B. 30 days. C. 6 months. D. 1 year. Answer: B. 30 days. This question tests the application of USP less than 795 beyond use date, BUD, standards for a specific formulation type. The keywords are topical cream that contains water, which defines it as a water-containing topical/dermal formulation. For these preparations, which include creams and lotions, the default BUD is 30 days. This is different from the 14-day BUD for oral water-containing liquids and the 6-month BUD for non-aqueous formulations. Correctly identifying the formulation type is the crucial first step to assigning the right BUD for safety and stability. Question 16. What is the primary advantage of using an ointment mill during the compounding process? A. It is the fastest method for mixing liquid ingredients. B. It sterilizes the final product through heat friction. C. It ensures accurate weighing of all powdered components. D. It reduces the particle size of solids in a semi-solid, resulting in a smoother preparation. Answer: D. It reduces the particle size of solids in a semi-solid, resulting in a smoother preparation. This question assesses knowledge of specialized compounding equipment and its purpose. An ointment mill is designed to enhance the quality and elegance of semi-solid preparations like ointments and creams. Its primary function is to pass the compounded product through high-shear rollers, which effectively grinds down any solid particles that were not fully reduced during trituration or levigation. This process creates a final product that is exceptionally smooth, non-gritty, and more cosmetically appealing. Think of an ointment mill as the final polishing step to achieve a professional, high-quality compound. Question 17. Which of the following best describes the characteristics of a water-in-oil, W/O, emulsion? A. It has a non-greasy feel and is easily washed off with water. B. It is hydrophilic and readily absorbs into wet skin. C. It is greasy, occlusive, and not easily washed off with water. D. It is a clear liquid that separates upon standing. Answer: C. It is greasy, occlusive, and not easily washed off with water. This question tests the ability to differentiate between the two main types of emulsions based on their physical properties. In a water-in-oil, W/O, emulsion, small droplets of water are dispersed in a continuous oil phase. Because the external, continuous phase is oil, the product will feel greasy, act as an occlusive, a barrier that prevents moisture loss, and will not mix with water, making it difficult to wash off. A classic example is a cold cream or a rich healing ointment, which contrasts with a typical lotion, an O/W emulsion, that feels lighter and washes off easily. Question 18. A pharmacist prepares a magic mouthwash prescription for a specific patient. Which document must be filled out to detail the ingredients used, including lot numbers and quantities, the person who prepared it, and the date of preparation? A. Master Formulation Record, MFR. B. Compounding Record, CR. C. Safety Data Sheet, SDS. D. Medication Administration Record, MAR. Answer: B. Compounding Record, CR. The question tests the understanding of the documentation required for a specific, individual compounded product. The key details, for a specific patient, lot numbers, person who prepared it, and date, all point to the compounding record. The CR is the worksheet or log that provides a traceable account of one specific preparation event, proving that the recipe from the master formulation record was followed correctly. Think of the compounding record as the birth certificate for that one particular batch of medication. Question 19. The manual technique for filling hard-shell capsules, which involves creating a flat cake of powder and repeatedly pressing the open end of the capsule body into it, is known as the A. Geometric dilution method. B. Punch method. C. Wet granulation method. D. Spatulation method. Answer: B. Punch method. This question is designed to test your knowledge of specific manual compounding techniques for different dosage forms. The description of making a flat cake of powder and repeatedly pressing the capsule into it accurately portrays the punch method. This technique allows a compounder to fill capsules with a consistent amount of powder by volume without the need for sophisticated equipment. It's a fundamental skill for manually preparing small batches of capsules in a community or hospital pharmacy setting. Remembering the visual of punching the capsule into the powder can help you recall the name of this technique. Question 20. When preparing a suspension, shake well before use is a critical auxiliary label. What is the primary reason this is necessary? A. To prevent the active ingredient from degrading. B. To ensure the drug is evenly distributed for accurate dosing. C. To activate the preservative system in the formulation. D. To cool the medication before administration. Answer: B. To ensure the drug is evenly distributed for accurate dosing. This question focuses on the physical properties of a suspension and the importance of patient counseling instructions. In a suspension, the active drug particles are dispersed, not dissolved, in the liquid and will settle to the bottom over time in a process called sedimentation. Shaking the bottle resuspends these settled particles, ensuring that the concentration of the drug is uniform throughout the liquid so the patient receives the correct dose with each measurement. Without shaking, the first doses might be too weak and the last doses dangerously strong. Question 21. Which type of spatula is most appropriate for handling chemicals that may react with metal, such as iodine or mercuric salts? A. A large stainless steel spatula. B. A small stainless steel spatula. C. A hard rubber or plastic spatula. D. A flexible metal spatula. Answer: C. A hard rubber or plastic spatula. This question tests the proper selection of compounding tools to prevent chemical incompatibility and contamination. The key clue is handling chemicals that may react with metal, like iodine. Stainless steel spatulas, while common, can react with corrosive or oxidative substances, leading to contamination of the product and degradation of the spatula. In these specific cases, a non-reactive hard rubber or plastic spatula must be used to ensure the chemical integrity and purity of the compounded preparation. Always consider potential chemical reactions between your ingredients and your equipment. Question 22. What is the maximum beyond use date, BUD, for a water-containing oral formulation, like a reconstituted antibiotic suspension, when stored in the refrigerator? A. 7 days. B. 14 days. C. 30 days. D. 45 days. Answer: B. 14 days. This question tests the specific USP less than 795 guideline for one of the most common types of compounded or reconstituted products. The keywords water-containing oral formulation and stored in the refrigerator point to a specific BUD category. Because water supports microbial growth, these preparations have a short shelf life to ensure patient safety. The default USP standard for these products is a maximum of 14 days when refrigerated. Remember this 14-day rule for any oral liquid that contains water unless the manufacturer's literature specifies otherwise. Question 23. A pharmacy needs to prepare 120 g of a 2% salicylic acid cream. How many grams of salicylic acid powder are required? A. 0.24 g. B. 2.0 g. C. 2.4 g. D. 6.0 g. Answer: C. 2.4 g. This is a straightforward percentage strength calculation, a fundamental math skill in pharmacy. The question asks for the amount of active ingredient, salicylic acid powder, needed to make a 2% cream with a total weight of 120 g. A 2% W/W, weight/weight, strength means there are 2 grams of drug in every 100 grams of the final product, so you can set up a proportion or simply convert the percentage to a decimal and multiply. 120 g * 0.02 is equal to 2.4 g. Always double-check that you've converted the percentage to a decimal correctly, e.g., 2% becomes 0.02, before multiplying. Question 24. A compounder is making an oil-in-water, O/W, emulsion. This means that A. Oil is the external phase and water is the internal phase. B. Water is the external phase and oil is the internal phase. C. The mixture contains equal parts of oil and water. D. The emulsion is anhydrous and contains no water. Answer: B. Water is the external phase and oil is the internal phase. This question tests the fundamental definition of an emulsion type. The name oil-in-water, O/W, literally describes its structure. Small droplets of oil, the internal or dispersed phase, are scattered throughout a continuous medium of water, the external or continuous phase. Because water is the external phase, these emulsions are non-greasy, hydrophilic, water-loving, and easily washable. A simple way to remember is that the second part of the name, water in O/W, is always the external phase, which determines the overall feel of the product. Question 25. Which of the following is an example of a levigating agent that would be appropriate for an oil-based ointment? A. Purified water. B. Alcohol. C. Glycerin. D. Mineral oil. Answer D. Mineral oil. This question assesses the principle of miscibility in selecting a levigating agent. The key concept is like dissolves like, meaning the levigating agent should be chemically similar to the external phase of the final product. For an oil-based ointment, the external phase is oil, also called oleaginous. Therefore, mineral oil, being an oil itself, is the appropriate choice to wet the powder and incorporate it smoothly into the base. Using an aqueous agent like water or glycerin would not mix well and would result in a poorly formulated, separated product.